if you are diagnosed to have osteoporosis, ibig sabihin yung T-score mo is negative, below negative 2.5, no? And then usually, there are many medicines available currently in the market, no? There is a once a day, there is a once a week, there's a once a month, there's a quarterly, and once a year, no? All has different mechanism of action. Basically, ang concept dyan is to decrease yung progression ng osteoporosis, no? So, mga different drugs, we have the alendronate sodium, roloxifene. If you are diagnosed to have osteoporosis, no, usually the approach is pharmacological. Ibig sabihin, gagamit ng gamot. No? There are many available medicines available right now in the market. We have a once a day, once a week, once a month, and sometimes once a year, no? These are in the form of medications like roloxifene, resedronate, alendronic acid, ibandronic acid, and alendronate medication. Usually, not only medicines are given to the patient, we also prescribe physical therapy and occupational therapy, no? When you say physical therapy, we apply physical forces in the form of hot packs, ultrasound, TENS in the treatment of osteoporosis, no? And then we also counsel the patient, especially in fall prevention technique. In the physical therapy, we usually prescribe what we call back extension exercises. Pinapalakas yung back muscles, no? And then sa OT naman, they usually teach the patient on fall prevention technique, how not to fall. In the house is modified so that the patient will not fall down. And then we also improve their posture such that the patient will stand erect, no? And then we also prescribe braces. No? There are many types of braces available sa market today, but usually the patients with osteoporosis, we give them what we call night tailored brace. Yun ang binibigay namin sa patients with osteoporosis. Okay.
Doc, discuss pa natin yung pinakahuling topic natin doon sa regarding osteoporosis. Baka may gusto pa kayong add.
Basically, one of the suggestions also is to avoid too much weightlifting. Okay. Usually, patients with osteoporosis, they are advised not to lift more than 10 to 15 pounds. No? The reason for that is para yung spine nila would progress to any further deformity. And then, we also evaluate their gait. Paano ba sila maglakad? Kasi sometimes, upon yung evaluation lang ng paglakad nila, malalaman natin whether they are at risk to develop falls, no? And if they are at risk to develop falls, then we give preventive measures. If you have any problems concerning osteoporosis, we would be glad to give you a service. This coming December 6th, we will be conducting a free screening and a lecture on patients with osteoporosis. No? Everybody is invited to join us, especially for those who are above 45 years of age, menopausal, if you're a male, above 65, if you have a history in your family that you have been drinking or had a history of steroids, or you are a chronic alcoholic or a smoker, I think we could invite you and to discuss with us the probability of you having osteoporosis. It will be held at CLDH, Department of Physical Medicine and Rehabilitation, 9 o'clock to 1 p.m. Thank you very much.
At yun po, natutunan natin ang topic regarding osteoporosis. So, mayroon tayong mga natutunan sa osteoporosis. Sana po sa susunod nating pagkikita dito sa Tik Tak Dok. At susunod na topic natin is physical therapy rehabilitation.